Can you afford your medical prescriptions in the UK? This video explains everything you need to know about prescription costs, who is eligible to have them for free, and more importantly, if you struggle to afford your prescriptions, what you need to know to try and make it that little bit more cost effective for you. At the time of recording this episode, the average cost of a prescription is just under £10, and that is unlikely to change unless there's significant changes within the NHS. And unfortunately, that may also increase over time. Some people are eligible to have free prescriptions, and we'll get to that list in a short while. If you want to check whether you are eligible for free prescriptions, have a look at this handy little website right here, and the links will be down in the descriptions and stuff to access it, which when you go through it will give you the information as to whether or not you can have free prescriptions or help with prescription costs. And the good thing is it only takes a few minutes to go through. So it would be helpful to talk about who is eligible for free prescriptions. And then, as I said, if you're not eligible for free prescriptions, we're going to talk about the key information you need to know to make your prescription costs more affordable. So when it comes to having free prescriptions, it's worth thinking about this in two different types of groups. Those that require a specific exemption form and those that don't. Patients who do not need an exemption form to get free prescriptions are those patients who are aged either under the age of 16 or over the age of 60. Or if you are between 16 and 18 in full-time education, or if you're currently an inpatient in an NHS hospital. If you're in either of those categories, then you should be able to get your prescriptions for free without requiring any specific forms. The other group of patients that can have prescriptions for free will often need to complete a particular type of form, which is considered an exemption form. So for example, if you or your partner, or if you are under 20, and the dependent of somebody receiving any of these following benefits, then you'll be eligible for free prescriptions. That includes income support, income-based job seeker allowance, income-related employment support allowance, pension credit guarantee credit, universal credit that meets the requirements, and certain forms of tax credits. If that's the case, then you will be eligible for free prescriptions. However, you may need to provide your certificates or the documentation to show that you're in receipt of those benefits or credits in order to have your prescriptions for free. In addition, there are some other patients who will be able to have prescriptions for free on completion of certain type of exemption forms. So, for example, if you're currently pregnant or 12 months after pregnancy, then if you have a completed MAP B1 form, you'll be able to have free prescriptions. This is normally done by the midwives at your booking appointment. If you hold a valid war pension exemption certificate and the prescription is for your accepted disability, or if you have one of the specified medical conditions that are about to follow and have a valid medical exemption certificate. What are those medical conditions we're talking about? Let's find out, shall we? So the specific medical conditions that will enable you to have free prescriptions with a valid certificate are if you have cancer, or if you're suffering from the long-term side effects of the specific treatments or the cancer itself, or if you have a permanent fistula, so this is where you've got a part of your body coming out, so things like colostomies, ileostomies, tracheostomies, and some kidney issues as well. A form of hypoadrenalism, for example Addison's disease, which requires you to take regular substitution treatment for. Diabetes insipidus, which is a form of hypopituitarism. Diabetes mellitus, which is the more commonly known form of diabetes, where you have difficulties with sugar processing, and specifically where you are having to take medication to treat it. Conditions where your parathyroid gland is not working effectively, so this is called hypoparathyroidism. A neurological condition called myasthenia gravis. What is medically called myxedema, which is where you have a low functioning thyroid gland which requires you to take substitution medication. Epilepsy, which requires you to take regular medication to control the seizures. Or a continuing physical disability that means you cannot go out without the help of somebody else, which is a permanent condition. If you have any of those, then if you complete the relevant form and have that submitted, then you'll be able to have free prescriptions. Alternatively, there are additional forms that you can fill, things like the HC2 and HC3 forms, which help people when they've got low income to afford their prescriptions. These forms you can often get from either places like the job centre or from your local practices, or look at them up online. And do check the criteria because they are quite strict. Now we're just about to get to the information that helps you afford your prescriptions if you're not able to have free prescriptions like all those categories we just talked about. But just before we do, it'd be really awesome if you could tap the like button, because it lets me know that this is useful content for you, and definitely share this with any of your friends or family that you think may be needing to know about this particular information, specifically when it comes to affording their prescriptions. At nearly £10 a prescription, the cost of having to pay for your medication if you don't have access to free medications can rapidly build up. For example, if you have 2 regular medications a month, that can easily be over £220 a year. I mean, that's nearly double more than what your GP gets to give you healthcare for the entire year. However, if you are having to pay for your prescriptions, you will be able to access something called a prepayment certificate. Prepayment certificates effectively fix the cost of what you will have to pay for your prescriptions. You pay a certain amount to either cover you for 3 or for 12 months, and then you don't have to pay anything more no matter how many prescriptions you have over that time period. So at the time of this episode, the cost of a 3-month prepayment certificate is £30.25 compared to the cost of a 12-month prepayment certificate, which is £108.10. This works out at just over £10 a month to pay for your prescriptions. So, as an example, if you have health conditions like high blood pressure, asthma, and high cholesterol, and require to take 1 medication at least for each a month, then that's 3 different prescriptions over a month, which will mean you'll be paying at least about £300 a year in prescription costs. And if you need any other medications over the year, then unfortunately it can be quite a significant bill. However, having the prepayment certificate for a year time frame means that you'll be saving yourself at least almost £200 a year, if not more. What a way to save on healthcare costs. How can you get a prepayment certificate? Well, it's actually really easy. You can go online, and if you want the link, have a look down in the description below. Alternatively, if you just search for prepayment certificate on the web, you will easily get taken to the website. That is often the quickest way to get one, so that you can actually cover yourself from the moment you've paid for it. Alternatively, you can ring the department that deals with this. Do search for the number. However, at the time of this video, that telephone number is 0300 330 1341. Additionally, there are some pharmacies where you can get the prepayment certificate directly. However, you do need to check because it's not all pharmacies. It is important to remember that it is your responsibility as a patient to make sure that all your certificates, such as the exemption forms we talked about earlier, or the prepayment certificate, is valid for when you're accessing your prescriptions. If not, you may unfortunately be subject to things like fines and penalties, so do make sure that they are always in date if you're using them. For more information about your medical health, check out this video right here that gives you more details about types of appointments in general practice. Alternatively, you can check out this video that YouTube's recommending for you. And as always, we're here to help tech enhance your primary care and learning. Catch you in the next episode.